world. You just talk. So tell me how the plant paradox changed
Okay,
your
the
life.
plant paradox.
Who are you?
I am Dr. Rosita Tan, practicing dentist for 37 years. I practiced in the Philippines for 11 years, and very good practice in there. And then I've been practicing here in Marina del Rey, California for 27 years, I believe. Estimated, I don't know. Let me look it up. But other than that, yes, this amazing woman came to my office as a patient, and I forgot how did we talk about these, or was it
Scott?
Scott maybe
Yep.
told my daughter?
Yeah. Yeah. You were just asking how we stay healthy and fit.
Oh yeah, because he came in, her husband came in looking like this, excuse the language, but goddamn healthy individual, you know. I said, well, what do you eat? And it tells me a little, you know. He's a man, he doesn't tell a lot, but enough.
Yeah.
And so I got curious, so I said, I'm gonna go buy this book. So when I bought the book on the first night, when I read it, and I was like, I couldn't sleep. At 2:30 at night, I said, this is, I never saw this before, you know, and it makes sense. So if you have common sense, you give it a shot.
Yeah.
What's wrong? Make an experiment out of yourself.
Yeah.
I didn't think I needed to lose weight, and I didn't, but I just didn't know that all that retained weight was inflammation.
Yeah.
Oh my God. You know, in a few weeks, got my sleep back, blood pressure went down. In fact, one morning, I think during the adjustment period, it was actually 80/63, which was a little too low. I said, I hope I don't pass out on this one. And Dundry was right. He said there would be a kind of a lethargic moment, you know, 2 weeks, 3 weeks. And I said, okay, this lethargy is enough. And then my daughter said, you know, you have this smell, Mommy, like, you know, it's a weird smell. I can't smell, you know. Some dude, DMD, and no, not DMD, MD rather, gave me some psych drug years ago because he said, oh, you know, you're irritable, let me give you a little Prozac. I said, I'm not depressed, I'm just irritable, you know, blah, blah, blah. They fix you with whatever, and I lost my sense of smell almost, so I can't smell. Anyway, she said I smell weird, and then my skin now starting to shed. Like every day when you wipe, it's dark. Towels after towel. So what's going on? It may be detoxing.
Yeah.
And this is just the beginning. My blood pressure went down. My sleep is back after almost 20 years of insomnia.
So how many months have you been doing the plant paradox?
Only 3.
Okay. And the difference that you feel is what?
It's amazing. I thought if I lost this weight, my whole face is just gonna literally sag down. Didn't look that way.
Mm-mm.
So far, you know, and it's really pretty exciting.
And so you've been telling people about the plant paradox and who?
Left and right, yes. And what I did to make it easier for my dear patients and friends around me, I print out the smoothie recipe just to get them going. And I said, just make it for 3 days. We don't have all the time to use the blender every day and wash it. So I wish. And yeah, just cook the green muffin, which I saw on his recipe and on YouTube. Dr. Gundry was, you know, cooking his thing. There you go.
What is that?
Smoothie.
So, you know, just to get them going, because, you know, when you read the book, you get overwhelmed and you
Yeah.
just want to get on with it, and you
Yeah.
go buy all this stuff.
Yeah.
And oops, we made a mistake. There's some soy oil in here and
Yep.
whatnot.
Yep.
So,
Yep.
yeah, to make it easier for my patients, because I've been through that struggle
Yep.
buying things, and the major thing was throwing so many things out of the house
Yes.
in the kitchen, right?
Yep. And cleaning your pantry.
In my pantry. So
Yeah.
there's a lot less things in there now.
And you're feeding your dogs healthier.
Yes, and just because I'm leaving, and I don't know if my kids can go through this, feeding the dogs that, I feel like murder. Even I'm supposed to be feeding them the best food
Right.
in the market.
Right. Yeah.
And I have a fat dog that has never hardly eaten any carbs at all, eat less than the two, probably food sensitivity issue, getting bigger and bigger every year. Oh, thyroid, she's old now. Let's give her a little thyroid. She's deficient, hypothyroid. Okay, I made her fur nicer, but she's still fat.
Yep.
Fatter and fatter and fatter. And so I got her into this, and now I haven't weighed her yet, but she now has a waist. She
Oh.
used to be looks like an overly stuffed burrito. Sweetheart, I don't want her to die yet. We're all gonna
Yeah.
die, but as Gundry said, hopefully we'll die like, what was that, the second book, the title, I forgot, but
Yeah.
I read it, yes.
Yeah. Yeah. Well, I really do. I mean, it's important that you continue to talk to your patients and continue to help as many people as possible, because it is
It's
important.
amazing. It is amazing, and I think Gundry is just one of those living angels,
Yep.
you know. And I
Yeah.
fully understand how he feels when he, by becoming him almost, understanding how it feels to be cleaning up all this mess in the heart, and only to do it again. I am that kind of a dentist. I do not like to keep doing the work. Prevention is the best key. Find the cause, prevent it. It's easier to clean up, you know.
Yeah.
Prevent a stroke. When you get a stroke, you get paralyzed, recovery from that, it's just a mess.
Yeah.
So prevention is the key, and
Yeah.
that's why I think the Gundry way is the right way,
Yeah.
and we should all at least give it a shot.
Yeah.
And a positive mind, of course, you know, open-minded as they call it, I think, right?
Yeah.
So, yes, that's
Yeah.
the best way. So
Well, thank you for saying those. I think it's
you're
important.
welcome.
And let's just scan this. I want him to see your waiting room.
Very
'Cause
humble.
that
waiting
is
room.
awesome.
Nothing fancy.